When I get up every morning, I think about how I can best serve my patients and my clients. I think about my superpower, so to speak, as a music therapist and how I can give a glimpse of the beauty of this world. And I believe music is one of those things that I can share with those patients.
Houston Methodist has been supportive of the creative arts therapies because they're an innovative balance between scientific and holistic approach to care, which is really core to Methodists' efforts in leading medicine.
When I start my day, I like to check my emails, check the census. I like to tune my guitar, maybe even practice a few songs for my clients, warm up my voice before I head onto the floor for the day.
It's very calming, very soothing. It brings the humanity back to us. Also, it speaks to the eye care value. So in the last 1 year, I've seen such a wide acceptance for actually music therapy that in fact I have nurses request me, Dr. Masood, can we get the consult for music therapists? And nurses are the most in tune to the patient day in, day out. The fact that they are requesting on a regular basis shows me it is making an impact on all the things they are dealing with patients, whether it is anxiety, confusion, delirium, scared, medication, and I think we are seeing the benefit on a daily basis.
When I first meet a patient, I like to get to know the whole person, learn where they're from, learn their friends, their family, that's their support system, learn their interests, their hobbies, things we would call social determinants of health here at Houston Methodist, getting to understand coping skills, triggers, all of these things that make that individual who they are.
The therapeutic relationship entails getting to know the person, having a rapport with them, really understanding how music plays a role in their life, and building a relationship so that you're working as a team to achieve their functional goals in tandem with the medical team's goals.
Good. Just a city boy, born and raised in South Detroit. Beautiful. He took the midnight train going anywhere. Feel free to sing along.
At this point, I'm focusing mainly on lung transplant patients, but I think this is a tool that we can use beyond this patients' populations in the entire hospital. They loved it, not just the patient, the family, and the nursing staff. They like to stay in the room, they like to talk with the patients, and they're asking me, Dr. Gudarzi, can we ask them to come back the same day?
COVID has affected infection control standards as well. Us being able to bring in instruments into the room can become a challenge. So less is more these days. So Mr. Garrett tells me you're having a good day today. I just want you to focus on taking nice, slow, deep breaths in, okay? Good. Amazing grace, how sweet the sound. The people of my team are wonderful to work with. Working with a team of creative arts therapists is amazing because they're creative and they're innovative and they come up with amazing ideas constantly. And we always find ways to lead medicine, as we say here at Houston Methodist.
The support from Houston Methodist has been embodied in a variety of ways. They've been open to what is really a fairly new clinical approach using the arts.
Colby was very sick before transplant. He was on a breathing machine and a device called ECMO, which is artificial lung, for a long time. Music therapy for him has helped us to be able to win mechanical ventilations and anxiety.
Okay, say your name. Okay, good.
So how about we try to start with this song and see how you're feeling after this one song, okay?
He has a weak voice. When I saw him start singing while on tracheostomy, the nursing staff was surprised that, singing with the music therapy it's a big motivation, not only for him, but also for his wife.
So, I heard there's a song, Little Bitty, that you like, so I thought maybe we could do, by Alan Jackson, I thought we could do that today. So, are you fine saying Little Bitty? One of the techniques that I brought into our session was what we would call therapeutic singing. We had our respiratory therapist support by bringing in a Passenger valve. And so I brought in one of his favorite songs, Little Bitty by Alan Jackson. And I encouraged him to sing the phrase little bitty and to accentuate the bitty as much as possible because it requires a production of more air to produce the B sound. Have a little love on a little honeymoon. You got a little dish and you got a little spoon. A house and a yard. There you go. Dog and a car. Well, it's all right to be. Yeah. You got a strong one in there at the end.
And do you twinkle little star?
I bet your 2 and your 3-year-old would appreciate that. Wouldn't it be nice, actually, if we can get you comfortable enough and we can make a video of you singing that to them and we could take it home to them?
Favorite song.
What do you think about that as a project we work towards? Yeah? I recently came back from maternity leave and I started on Monday, and it was hard for me to leave my newborn at home. But my first day back, and I had a chance to go on the floor and see a patient. And I knew I'm still doing what I'm supposed to be doing because I touch my heart every day.